Hey everybody, it's been a while, but it's time for another episode of Ask Dr. Testosterone, starring Dr. George N. Touliatos, brought to you by his book, The Bible of Bodybuilding 2, over 700 pages full of everything you need to know about training, nutrition, supplementation, and of course PEDs. Get that on Amazon.com. While you're on Amazon, pick up a copy of this great book, Real Bodybuilding by Ron Harris. And now all the way from Athens, Greece, please welcome George N. Touliatos, the good doctor. How are you, George?
How are you, Ron? I wish you a speedy recovery from your last night's surgery.
Look at that.
Robocop.
Yeah, I'm becoming part machine, part like a cyborg. But I'm so happy. I'm so happy I got a new shoulder joint. I can't wait. I should have got this done 10 years ago. I waited way too long. So anyone out there, if you need a shoulder replacement, don't be stupid like me and wait years and years. Just get it done. You know, I lived with pain for years and I didn't have to. But
so the problem was with the bone, with the humerus and the scapula.
Yeah. So the top, I was bone on bone for about 12 years. So it was rubbing. The bone was just scraping.
No cartilage?
No, cartilage was gone. My cartilage was gone like almost 15 years ago. So in the x-ray, I don't have them on screen, but about the top half inch of my humerus was gone. It was just worn away. But luckily I was a good candidate. My rotator cuff was intact, so they didn't have to do a reverse shoulder replacement where they put the socket where the ball was and a ball where the socket was. So mine's anatomical. So I should be up and about. I just have to wear a sling for about the next 3 weeks, and then I can start getting back into normal activities again. I don't know. I don't think I'll be bench pressing 500 pounds, but you know what? I'll be out of pain, and I'm very happy.
2013, you competed with a shoulder pain, huh?
Yeah, because in 2011, I had arthroscopic surgery just to clean out the joint and make some more room, so it wasn't rubbing together. But that lasted about 3 years, and then everything started back again. So, and I did cortisone injections I probably had 20 cortisone injections over the years, it's not good to have those over and over again. They weaken the soft tissues in there, but it was masking the pain. It was just like, I was just avoiding putting things off, procrastinating. But yeah, it's all set now. I just need to heal up and I'll be good. Yeah. All right. Ready for some questions? It's been a while.
Yeah.
Here's a good one. Doc, to produce testosterone, do you need 5 egg yolks or is that too much? I've heard that a lot of cholesterol turns into LDL.
Well, it depends on your liver, if you're genetically predisposed for that. I mean, 80% of the cholesterol is made up in the liver and 20% is only from the diet. So there are people that they eat a lot of cholesterol, but their liver does not make that much of cholesterol and vice versa. They don't eat cholesterol, but the liver makes. But certainly cholesterol is necessary in order to make testosterone. But you can eat steaks as well. However, I believe the egg yolk is far superior than the steak in terms of nutrition aspect. And I think that eggs raise less cholesterol than the steak. Well, I'm talking about the lean cuts, okay? Filet mignon and the clean cuts from a T-bone, for instance.
Yeah.
By the way, lowering cholesterol by the statins will lower, of course, the testosterone because you don't have the substrate to make testosterone from cholesterol.
Yeah. Yeah, it's because, a lot of people, you've said this before on the show, that cholesterol is very important in the process of the body manufacturing sufficient testosterone. But, especially in America, we're terrified to eat egg yolks. We're worried about cholesterol. Red meat is supposed to be bad for us. But the old school bodybuilders, like I remember reading about Franco and Arnold. They used to go to breakfast before they trained, and it was always steak and eggs. That was their breakfast every day.
Yes, steak and eggs, very anabolic. I mean, also in the Venice Firehouse restaurant, they have steak and eggs, the classic low carb, high protein breakfast. But I'm having on a daily basis 3 eggs, 3 whole eggs as an omelet, okay?
Yeah.
And of course, I'm taking also my statin very low dose,
Yeah.
just to prevent any, plaque in my carotid because my coronaries are clear. But I think having very low LDL as cardiology requires is not so anabolic.
Hmm. Sort of leads us in our next question, talking about plaque in the arteries. So someone says, I just had a cardiac CT scan and my calcium score is 9. I'm 52 years old, 5'11", 180, very lean, train 5 days a week and eat super clean. Any advice to help? Is a level of 9 problematic?
No, I don't think you also have a low plaque, right? Calcium score, but
No, I thought it was. And then I had to meet with a cardiologist to get cleared for my shoulder surgery. And my last calcium score was over 400. So I guess I do have more calcium. I do have some more calcification than I thought I did.
you need to stay on the Lipitor.
Yeah. I stopped taking Lipitor, but I am on that Repatha injection every 2 weeks, which
Best thing. Yeah, Connor said that. Yeah.
Yeah. So so if this guy has only a 9, which it says that's minimum.
Okay, but try to stay that way. All right. So don't do steroids. Don't smoke, of course. Don't eat crap. I mean, I wouldn't say that much saturated fat, but trans fat and refined sugars. Okay, a little bit of saturated is not bad. The point is, if you mix it with simple carbs, is the bad thing. Like they're into inflammation. All right. So having a steak with salad is not bad, but having a steak with white rice, with white bread, with white pasta is not a good idea because you spike the insulin.
Yeah, I mean the classic side dish with steak here in the U.S. is a big baked potato with butter. So that's white potato. It's that's going to drive your insulin up too. Did you have an overall calcium score recently?
The last time was 2022. It was 0, but
wow.
Yeah.
Wow.
I'm gonna do now in my 50s another one, and let you know.
Did you just have a birthday, or your birthday's coming up in a couple of weeks?
Yeah, I think it's next month, next Wednesday.
You'll be 52.
Yeah, exactly.
Still a young man. All right, great.
Well, the second half of my life. Huh?
Yeah, I mean, your grandmother was 109.
106. Yeah.
106. Wow.
But hopefully, people of the 21st century, they have to live up to 100. We have so much knowledge. We have so much supplements. We have so many medications. We have the know-how. We know how to train, how to eat. So supposedly, we have to live up to 100.
Wow.
It's not just.
Well, I mean, the problem is we're not having babies anymore, at least in America. So there's going to be all these old people and no young people left to take care of them.
Same here. They want to lower the population.
Yeah, it's called, I can't remember, the graying of America, I always hear. And
same in China. They punish you if you have more than children. I mean, you pay taxes. You pay something like a fee if you have more. Yeah. It's 1.3 billion. I mean, it's the 20% of the world global population.
Yeah, they were 1 billion years ago. I bet there's like 1.5 billion Chinese now.
And the problem is that you have old people like here in Italy. You can't afford the state to pay the pensions.
Right, that's what I'm saying. Didn't that happen in Greece?
Yeah,
because there was just not enough young people working to support all the old people. Because that Mediterranean diet keeps you guys living forever. Very healthy people. All right, next question is, Dr. T, I took saw palmetto for my hair and lost my libido. What do I do now?
I think this is overkill. It's too much. Well, supposedly it kills the DHT. But what about if taking DHT blockers like finasteride, dutasteride, for instance, or even progesterone? So what I do, just go back without palmetto, or take provarone, take DHT, or even increase your testosterone dose. All right, because DHT is good for the sex drive and the clarity. But on the other hand, if you are prone to this, you're going to have hair thinning. All right.
Okay. Hey, you know, we were talking about, so I'm on an opiate right now, just the Oxycontin, just for like a week.
It's lower to testosterone, but not to you because you're taking testosterone.
Well, I can already tell my sex drive it's like almost, it's gone.
Even though you're on TRT.
Yeah. So it's very powerful. These opiates, they're no joke.
Those people that are stoned and that are not on testosterone.
Yeah, they would have zero sex drive. I wouldn't say I have no sex drive, but I'm not thinking about it all the time like normally I would. So that's actually a good thing. Well, you just talked about finasteride and dutasteride, so that leads right into which is better for my husband to control hair loss, finasteride or dutasteride? Is oral better or topical on the scalp, which has fewer side effects?
Definitely dutasteride works more but has more side effects. Finasteride has less side effect but doesn't work so well. And of course, peros, that means oral is more effective than topical, while the topical has less side effects. So the more side effects, the more it works.
So I guess you pick your poison, right?
If I were somebody that I was very, devastated and I wanted so badly to have hair, apart from the transplant, I would go on dutasteride and testosterone for 6 months, take also finasteride, all right, kill my DHT literally, take biotin, take ketoconazole, and take also minoxidil and progesterone, and wait for 6 months to have my hair back, and it works. But the point is you have to forget about sex for this time window, and you're not going to be so optimistic, but you can have it all. There's no free lunch.
Just go to Turkey like I did. Go to Turkey, everybody.
I think once doesn't it's not enough. You need at least 2 operations.
I mean, so I'm pretty happy right now. I can't complain. Yeah. I still have a little. It's pretty thin up here still. It's not like it was, but I can't see the back of my head anyway.
You had a haircut now for 1 year?
Yeah. So I had it done in early February of 2024, and so the full result is it's not going to get any better than this.
But no haircut, eh?
The what?
Do you have a haircut?
Oh yeah, I have haircuts all the time.
Because if you don't, they're going to grow more.
True, but I mean, I don't want to have shaggy hair. I don't like having long hair. Just, I don't know, it's not my thing. Is this our last question coming up? Yes. Okay, last question. I'm a woman who is very anemic. Can testosterone injections help increase my red blood cell count, or does that only work for men? What dosage?
Yes, for women, but I think injections would be the best idea. You can use the cream, okay, and you can stack it with DHA as well. Now, virilization is the other thing, that the voice deepening, the clitoris enlargement, and the hirsutism. But yet you can try 1% or 0.5% cream of testosterone along with DHA.
Yeah.
All right. And of course, you need injectable cobalamin, folic acid, and also IV iron. Otherwise, take iron with vitamin C in order to increase your hemoglobin.
Okay. Yeah. You know, my wife is on testosterone now from Frontline Alternative, just like me, for her menopause symptoms.
But not only testosterone plus estrogen progesterone, right?
No, she's just on testosterone.
Oh, come on. I think she needs the 3 hormones. Come on.
Well, they only give her 25 milligrams of testosterone a week.
Yeah, but that's one part of the equation. Okay, you need also estrogen and progesterone. This is vital for women.
Yeah, I don't think she's on anything else. I'll have to look into it. Maybe I'm wrong. I've been wrong many, many times before. Cool. Well, so far she doesn't feel any different anyway. It was for her energy levels and things like that. So yeah, we'll see. But that's it, man. That's our show. Let's get some questions in, guys. Submit some questions here in the comments so we don't have to wait another month to do a show next time. We are here and very, very fortunate every week to have a medical doctor who's also a champion bodybuilder available to ask your questions that your doctor can't answer for you. So thank you, doctor, for being available for the people of the world like this. Very, very appreciated. And that's it. So drop some questions and comments below, guys, and we'll see you right here next time on Ask Dr. Testosterone with Dr. George Touliatos.